Hello, and thank you for joining us for one of 3 podcasts about kidney transplantation. Today, our special guest is Tina G., who is going to share her thoughts on transplant from the caregiver's perspective. My name is Jerome Bailey, and I'm the Associate Director of Patient and Family Engagement with the End Stage Renal Disease National Coordinating Center. We partner with patients, healthcare providers, and the Centers for Medicare and Medicaid Services, also known as CMS, to create and share resources that help kidney patients improve their quality of life. Most people are born with 2 kidneys. Each are about the size of a fist and pack a powerful punch in terms of the amount of work they do for the body. Healthy kidneys clean waste from the blood and make urine. They keep elements in the blood like sodium and potassium in balance. They also make hormones that control blood pressure and red blood cell production. When the kidneys stop working properly, it can lead to kidney failure. There are more than 100,000 Americans living with kidney failure who rely on the kidney transplant to keep them alive. Most of those individuals count on the support of a loved one or friend to get them through the transplant process. Today, I'm speaking to Tina G. Her husband received a kidney transplant in 2017. Ms. G was her husband's caregiver both before and after transplant surgery. The caregiver plays an important role in the transplant process, helping his or her loved one, friend, or family member in a variety of different ways. The caregiver may help with ensuring that medicines are taken at the right time or coordinating doctor appointments. Their most important job may be to provide emotional support. The role of caregiving is often said to be one of the toughest and also the most appreciated. Ms. G., may I call you Tina?
Yes, but at this point in my husband's transition, I prefer to be called the care partner. That denotes a more agreement between the person who has a chronic condition, and I'm just helping him along, and we agreed to help one another in his transition.
Well, thank you, Tina, and welcome to the podcast. How did you learn a kidney transplant was an option for your husband, Patrick?
Patrick and I had discussed all of the options that were available to him at that time and what our future plans would be. He wanted to live a fuller life, to be with not just me, but all 9 of our grandchildren. So after more discussion and research and reviewing all of our options, we both carefully agreed on a kidney transplant.
What was your role in the decision to seek a transplant?
My role specifically was I kind of shared with him what I wanted our future to look like and my future to look like as a married couple. We both ministered to the sick and shut-in pertaining to those suffering with kidney disease and their support systems. We maintain a very involved partnership in our decision-making when it comes to our health. So whatever else Patrick also impacts me.
How involved were you in your husband's care before he received the transplant while he was on dialysis? And how did that change after the surgery?
Patrick was very independent, and he had to be. My work schedule had me traveling a lot. But on those days when he was either too sick or too fatigued to move and at loss for strength, I would have to step in and be the caregiver that he needed to assist him with his care. After his surgery and the constant challenges that we endured after the transplant, my care became more pronounced. His care became more pronounced. He had his surgery for his transplant on April 21st, 2017. 5 days later, he had a blood clot in his neck, so then he had another surgery. So 3 days after that surgery, he was bleeding internally. So he had a third surgery. 17 days later, he had a 4th surgery. That's a lot of surgeries going on just for a kidney transplant. But everybody's different. When he had the 4th surgery, they removed a J tube and created a peritoneal window so he could drain internally. About 33 days into the hospital, his kidney finally woke up on the 47th day. Now his needs became more intense because he needed to go through home therapy to come home. He came home with an open wound. He had to wear a wound vac, and he needed to be changed every few days. He needed bandages, changed as well as assistance learning how to walk and get up and down our stairs in our home. So my role was very important then.
So how did those complications impact you?
If I wasn't healthy, how could I be a good caregiver for him? It was a lot of stress on both of us, but we both had to learn how to endure both my stress and his stress. He understood that, yes, he was the patient. I understood he was the patient, but we gave each other plenty of space to just be us. So with good communication, telling each other, hey, I'm having one of those days, I don't think I'm going to make it, then the other person would pick up the slack and do what needs to be done throughout the day.
Now, were you able to get help from family and friends as well?
There was no help for family and friends for me. Most of our families live out of state, so there was no family and friends. The only time we did get assistance was when he came home with the wound back, and I had to go back to work. There was a nurse that was that was assigned to us through an organization, and she came out that week I was out and changed the dressings and did things that I would do as a caregiver.
What changes have you noticed in your husband since his surgery?
He's had more energy and stamina. He's more cognizant of his health challenges. He's encouraged not just me to be a better manager of what's going on in my life, but both of us. We eat cleanly now, and we exercise more, and we just kind of want to be healthy to one another. Our relationship is thriving better than ever. All that we have endured individually and collectively. My role has changed, and I'm no longer the caregiver. I became his care partner. Now I had a front row seat in witnessing his transformation from his peritoneal dialysis 5 times a day, 7 days a week, 10.5 hours a day, and then he received his gift of life. And dealing with those challenges that the organ, presented to us, we're much happier, healthier, and active in our advocacy.
What advice would you give to a caregiver whose loved one is thinking about getting a kidney transplant?
Keep in mind, everybody's different. If you can't care for it, you can't care for anybody if you're not healthy. You'll care for yourself, and your needs come first. It isn't being selfish, but you can't fill an empty cup if you can't pour anything into it. You need to find your balance with all that you have going on. Always keep the lines of communication open. Don't take it as a sign of weakness to say that you can't handle a particular situation. And if you need assistance, ask for it. You're only one person, and you need to remember that at all times. Just don't do anything. Do what you can, and understand that you need to care about your well-being just as much as you care for your partner or that person that you're giving care to.
Tina, it has been a pleasure to speak with you today. We are grateful for your time and dedication to improving the quality of life and experience of both of your husband and all of those touched by ESRD. Thank you.
Thank you for having me. It was a pleasure.
We thank you for listening to this podcast. To listen to the rest of our podcast series on transplant or for additional information on the kidney transplant process, visit the ESRD NCC website at www.esrdncc.org or talk to your healthcare provider. Thank you.